There's a significant percentage of type 2 diabetes that's associated with weight, or to better put it now, fat. But that's not to stigmatize the word fat. So this is the issue. So we've got a problem, but we don't have an answer. The problem is BMI doesn't work properly. But what's the answer, especially when it comes to linguistics and the language of talking about weight? Because this is my personal view. If we talk about weight, it feels nicer and more appropriate than talking about fat. But fat is the problem with the weight. It's not the weight itself. So when we think about the BMI, we think about the height weight ratio, but it doesn't tell us where the weight is being held in the body. And if it is being held more in the middle, then that weight is more likely to be fat, and that fat is more likely to be around your organs and inside your organs and stopping your organs working effectively. Essentially, think about the intestines as your roads and highways to the factories, and then you can think about the rest of your tummy, the liver, the pancreas, all of that as the factory itself. And if it's covered in soot, or it's not cleaned out properly, or it's not able to get through and things aren't able to travel easily, then of course it's not going to work so efficiently. And that's essentially what's happening when you're infiltrating more fat into the system. So there's the medical way of viewing it, but then there's also the societal view of what it means to be fat, as the term fat instead of using weight. And I specifically say here, I'm liberally using these terms without meaning to cause offence. It's just talking about the subject, really. So, question around BMI: should we use it? Should we? So, Dr. Leah Jacob, this doctor who we mentioned before off the podcast, who's a haematologist, clinical nutritionist, and health coach, she has coined the term "should we bin the BMI?" Oh, she says we need to bin the BMI. My position, and I totally get the position of that, my position is that there is still use in the BMI because we don't have a better alternative yet that the public will easily understand, that is universally used across the UK. So I do think BMI should be phased out, probably. It could be a BMI plus kind of model, so it could be BMI plus more information. That could be one way around it. Or another way is that we phase in a new model, and that over the next decade, then BMI gets phased out. But it's going to take some time. So the issue is this: BMI doesn't tell you where your fat is, and it doesn't tell you about your body composition between muscle and fat. And really, if we were to flip it and say it's not about the fat and it's not about the weight, then what is it? And say, well, what is the positives of this? It's about your muscle. So if we were to maximize your muscle compared to your weight or compared to your fat, then we're changing things. A less accurate way would be muscle to weight, but it's more softer in a way from a language perspective. But a more accurate way would be to compare your muscle to your fat ratio. And when you have more muscle compared to fat, then metabolically speaking, you're going to be working better because it's your muscle that are using. If we think back to caveman times, prehistoric age, we assume that we had no brains then, but we did absolutely have brains, the same brains as we have now. But let's go back to then. You have food, it comes in, we need to reproduce. We have food, it comes in, it needs to be processed. And then as part of that, what do we do with the food that's been processed? Yes, okay, we do lots of important body processes. What do we do with the excess of it? We turn it to muscle. What does muscle do? It allows us to move, allows us to procreate, allows us to continue the cycle. So the end point is muscle. At the moment in our society, it's not the only endpoint, it's a big endpoint. At the moment in society, one of the big endpoints that we're missing is muscle. So in a way, we could change the story from fat and weight and switch it to muscle, which is great for the bodybuilders out there. And that's why athletes who have high BMIs are not sick, and why society doesn't see them as unwell or sick, and they don't get diabetes.